health and the emotional and spiritual well-being of our mob is clearly connected to land and clearly connected to country. I'm Goodnich Mara. I'm part of the traditional owner group down there. I've got strong links down there through my grandmother and some extraordinary stories to tell you about things that have impacted on us as a family, you know, trauma and all that type of thing. But what I wanted to do is just talk to you about VAHS for a little while. We're going to tag team today. I know that Lionel Austin's here and Gavin will speak and some others. And I've been at VAHS for about, I'm 74, about somewhere between 30 and 34 years. I mean, after a while you do stop counting, trust me. And I've held several roles. I've been on the board for a long time, chairman a couple of times and CEO twice, and don't want to do that again, and men's unit and stuff. But it's just a wonderful place to be involved in, and clearly a place where I committed early on as a young man, and I and many others, by the way. The retention rate here is quite high. 34 years is a long time, but there are many staff and other people in the community of 20 years plus, working in a diverse organisation, but also working through the adversity and the challenges that we have working in the Aboriginal Health Service. You know, dealing with the clients that we have to deal with, working with government that is with us or not with us and all that type of thing, and trying to find, you know, like that extra penny to get things going on, all that types of things. So there's some of the challenges that we've experienced at VAHS over a period of time. Very humble beginnings. This is a beautiful building that we're in and lovely landscape. Colin mentioned, like in 1972, a group of Aboriginal people decided that that even though we're 2 kilometres from St Vincent Hospital, it's not their fault, but 2 kilometres from St Vincent Hospital, the mainstream services might as well been on the moon in terms of access and equity for Aboriginal people. Now, people were literally dying rather than deciding to go and seek medical help. Racism and other barriers were part of that. And the rights of Aboriginal people in terms of our health status were not being met. Our rights to a good health, our rights to be able to express where we want to get that good health, where do we want to get that service, just weren't being met. And the right to control our own health as an individual, as a family, and as a group of people, as a community, just was non-existent. Thus the formation of Aboriginal Community-Controlled Health Services. Started in Redfern, 1972, a fantastic group of people. We met with them in Albury not long after that, and then we formed the Victorian Aboriginal Health Service, and we've gone from strength to strength to strength based on that. And we're still a rights-based organisation. We still advocate for the rights of Aboriginal people. The very same rights that we spoke about way back then are still current today. The rights of Aboriginal people to determine our own destiny, to determine where we want to decide what health service we get. If we want to go to PHN, lovely. If we want to come to VAHS, that's a choice. But it's all about the choices and the right to be able to do that. But it's also got to be safe. You know, it's got to be the right place for us to go. It's got to be culturally safe and all that type of thing. So they're the things that I think make VAHS different. So very humble beginnings. 229 Gertrude Street, a little rundown little building, and the people that we lovingly call the parkies, who are the itinerant men, homeless men. They were our volunteers, and they come and clean the place up with my nan and with my auntie and with other people in our community. Clean the place up, and we borrowed a doctor from St Vincent's. She came down in between shifts. First administrator was working in bars at night, looking after 7 kids, but Auntie Alma Forbes is an extraordinary person in terms of her commitment to this place. So really humble beginnings way back then to now, where we've got 4 sites. This one, Nicholson Street, Plenty Road, a new satellite clinic in Epping, which is a long time coming. It was on the radar, been on the radar for a while. We've finally got it. Plans to go west and all that type of thing. So, you know, once the seed's planted for VAHS, you know, we sort of get into it and things will move fairly quickly. And we also, in partnership with another youth group, we run Bunjalwarra. Now, Bunjalwarra is a youth, 24-hour residential youth alcohol and drug rehabilitation centre. And when we talk about VAHS, we talk about community control. And that doesn't mean, you know, we've got a board of directors we've got 350 members, something like that. Our members are politically aware, they're astute, and we elect 7 Aboriginal people from that group to become our board and manage the governance. But it's not, but a community controlled organisation is much more than just having 7 people as your board. That'd be too shallow. That's way too shallow. Anybody can do that. Anybody can have Aboriginal people as your board. But what are the layers underneath? You know, the checks and balances. You know, the history, the commitment to what you're going to do and all that type of thing. And that's what our members and our community bring to us. When we first started, we talked about, we get a sense of direction from community. We get feedback, we encourage feedback, we have meetings, lots of conversations, and we've got good staff who are able to accumulate all that information and to gather it into what it is. When we first started, it was middle ear infection. Some of you might be aware of middle ear infection, you know, glue ear and all that type of thing. It was rampant amongst all our kids. But so that was a health issue of the day. More recently, it was ice and the impact of ice in our community. Every family in our community has been touched by the impact of ice. Some more than others, but every family. And people decide themselves what to do with this. Hence the opportunity to set up Bunjawara came, where we became partners with VAHS, and with a transition where we'll run that pretty soon. And it's an opportunity for us to respond to young people who want to deal with the drug and alcohol issues. So that's community control in action, where we're able to listen to community and be able to deal with it. While Austin will talk later on about the preventative stuff, where people, for example, I'm not still on a Sunday, but you know, smoking is high rates in our community. You all know the impacts of smoking and what it does to people, and in our community it's fairly high. So we have to provide a response to that. It's no good just going to the doctor and the doctor says, "Oh mate, you just want to give up the cigarettes, buddy." Now that's just not good enough. So therefore we have to have other things behind that gives Lionel the tools to be able to deliver all them types of things. So VAHS has been, we're a political organisation, we're a community organisation. Last Friday we talked about the treaty. We had our members talk about the treaty, and there's some significant decisions that we made as a group. It was quite a good, strong conversation. And VAHS, I'm going to steal Gary Murray, our chair, might announce that sooner or later. Not for me to do that, but we did create a position on the treaty, and we did create a position where we want to talk to Wurundjeri. VAHS wants to talk to Wurundjeri, Upper Colin and everyone else, and we want to negotiate our own MOU with the Wurundjeri. And the first thing we will say is we acknowledge the sovereignty of the Wurundjeri people. And that'll be it. So that's where we're coming from. Because when we talk about land and sovereignty and all that's connected, we're talking about health. You can't have a distance between how important they are. That's a difference that VAHS brings in terms of the culture and history. When we talk about emotional and social well-being, when we talk about spiritual well-being, we're talking about hundreds of thousands of years of culture and all that brings. I just want to finish up because I know that it's a mental health focus, and when we think about things that we need to do in our community, and by the way, lots of the things that we've done at VAHS and other health services, but at VAHS, we're one of 150 Aboriginal health services in the country. Right? Some really big ones. Kimberley's is huge. You know, they run a big network. Well, you know, I mean, networks is quite an interesting word. Like the network of Aboriginal health services is also quite extraordinary. Now, like an early doors for VAHS, we would send doctors out to Shepparton and to Warrnambool and to Gippsland. So we've sort of been the initiator of many of the Victorian services, that type of thing. I mean, that's sort of our role then. Maybe not so much now, we've got our own community to look after, but way back then, we did all that, dental services, mobile, all that type of stuff. We also started to formalise the sort of one-stop shop sort of concept, you know. You come in here, you can see a psychiatrist, you can see a counsellor, you can see a health worker, you can see a GP. You might just want to come in for a cup of tea, but it doesn't matter what you come in for. So that's sort of VAHS in a nutshell. And we know that other community health centres adopt and like that type of format. And we say go for it because it works. So in terms of mental health, one of the things that we have to do, like I said, is we have to think about what makes us unique, what strengths do we have that we can develop what we need. And we're just starting to develop an idea about suicide prevention. It's too high. Suicide is just hurting us and it just knocks us about like it does for everybody. And we have to sit back and reflect And whilst we use the mental health system, that's really important in the cure of our people. There's lots to value add to what we do. We realise that one of our strengths is our families and our clans, extended families. And when we talk about if someone's thinking about self-harm, who best is going to look after that person or keep an eye on them than their clan, than their family? Don't engage. We don't need to bring in someone to monitor somebody. It's our job to monitor our own. All we need to do is skill up our mob in mental health, in the recognition of mental health, and recognition of self-harm, to listen to the clues and signals that you get on people, and to keep an eye on people, and to watch our own people. And we might do it in shifts. Sounds clinical, we might do it in shifts. I've got 4 brothers. If someone in our family needs to be cared for, I'll do it for a little while, then my brother will do it for a little while, then my nephew will do it for a while, but we all take care of our own. So it's a clan-based approach to suicide prevention. And that's something that we can do in our community because that's what we have. We have them strengths and we need to utilise. So that's the difference between VAHS and all the other services, I think, in terms of mainstream and other things. We have this opportunity, but also that clan-based approach, once we develop it, can work everywhere else. I mean, I don't see why it couldn't. So that's VAHS. That's sort of what we do. That's some of the things that we're heading. So welcome to VAHS, and I'll leave it at that. Okay.
Thank you so much.
No.
And is Lionel now? No.
Thanks, Anna. That's really fantastic. The next person who's